Hi, everybody. I think we all jumped in at the same time. I'm so sorry. I had computer issues trying to get in here. Can y'all hear me okay?
Mhm.
Okay, cool. Let's see. We had about 19 that were going to join us, so I will hold off for a few and then see if we can get some other folks up here. Give it like a minute because we're a little late. Sorry if y'all hear my son in the background. All right, y'all. Since we're already a little behind schedule, we're recording this session, so I will have Mac post it after. And so I'll introduce myself real quick. My name is Jennifer Cranford. I'm the Director of Learner Success and Support at the College of Health and Human Performance. And we would like to spend some time with you tonight talking about our wonderful HEP Health and Education and Promotion programs. So we've got Kelsey, who is going to go through one of our lovely advisors here at HHP. We love Kelsey. And I'll let everybody else introduce themselves as well. But the time frame for tonight will be Kelsey will go over the highlights of the program, and then we'll turn it over to Riley for some student ambassador experience, and then we'll wrap up with some questions. So I will let everybody go around and introduce themselves. I'll call names so we're not just winging it. And then we can get started. So Riley, you want to go first?
Hi, I'm Riley. I'm a senior public health major, and I'm one of the ambassadors with the college.
All right. Kelsey, I'm going in order on my screen.
Hey, I'm Kelsey Webster. I am one of the advisors for the public health major.
Awesome. Rachel.
Hi, and I'm Rachel Hodges. I advise for the other half of public health with Kelsey, and then I'm also the advisor for environmental health.
Awesome. Last name is Hill, I think.
That's right. William Hill, program
Hello,
director
sir.
for, I'm sorry.
I said hello, sir.
Hello. Program director for environmental health.
Awesome. And Sydney.
Hi, I'm Sydney. I'm a junior and I'm a public health major and I'm one of the ambassadors as well.
Awesome. And admissions.
Hi everyone, my name is Terrence Holloway. I serve as the regional admissions counselor for undergraduate admissions.
I think that's all of our people. So, Kelsey, if you want to go ahead and get started, I'm going to mute myself and get out of y'all's way. I can't hear you.
Hello. So sorry. Can I share my screen or do you have to, can only you do it since
I
you're the,
think you can share. If
okay.
not,
Actually, I got it.
okay,
All
perfect.
right. Yep.
I know
So,
Zoom is different, so.
yeah, I know, right? Yep. So, hi, everyone. Again, I am Kelsey Webster, one of the public health advisors. And so, this is just a brief overview of our public health major. All right. So public health encompasses a lot of different areas, everything from, practicing medicine to community health education to health in the workplace to epidemiology. This is just, a few of the other areas of public health that students go on to deal with, once they're in the public health major or once they've graduated. It also has to do with everything from the water we drink every day to the air we breathe, just, health as a whole, even down to wearing a seatbelt. That was a public health initiative part of on the community health side. But yeah, so again, these are just some of the different areas of public health.
And Kelsey, I'm gonna pause real quick. All I can see is it's like a background screen. I can't see the presentation. It's like the just like the background for Windows. There you go. And
Okay.
then
There we go.
yep, you got it now. You got it.
Okay, yep. So this was the slide that I was just on. And then see, it doesn't want to work on the screen. There we go. Okay. Our wonderful public health faculty. So these are some of the words that our students in the past have used to talk about the public health faculty. They are all fantastic, very, very approachable, very knowledgeable, love to work with our students, on research, just helping students be the best that they can be. Once you get into your upper level public health classes, the student classes are pretty small, so the professor to student ratio is, it's not like another major where you might have 200 students in a class. So that is a great part about our program as well. And then we have 3 concentrations for students to choose from: community health, pre-health professions, and worksite health. Pre-health is for students that want to go on to like PT, PA, med school, dental school, any sort of program where you want to go into practicing medicine. So it actually builds in the prereqs that you need for that medical program right into your 4-year degree. But unlike a biology or chemistry degree where you might have to take upper level sciences that you don't even need for that program, with pre-health, you only have to take the sciences that you absolutely need for your medical path. And then you have your health classes that help to keep your GPA high. You'll also have like a health problems class, health disparities, patient education, things like that, things that can come in very handy for interviews. In like a dental school interview, they're probably not going to ask you about organic chemistry, but they might ask you about your patient philosophy, in which case you would have gotten that from your health classes. And then and that is our most science heavy and our most strenuous concentration to declare. And then we have community health. This is for students that want to go on to become like a community health educator, or you can work more in health policy. But those students typically work in like clinics, hospitals, nonprofits, government at various levels, city, county, all the way up to state and federal. Those are really big employers of the community health graduates. And where community health focuses more on the public sector, the worksite health promotion concentration focuses more on the private sector. So it has to do with public health in the workplace. A lot of those graduates go on to work for private employers, probably of a decent size if they're going to have a wellness expert on site, but they work with employees on like smoking cessation, work-life balance. You might give a little bit of diet and exercise advice. There's the health policy expert on site for that employer. And community and worksite do both require an internship, which we will touch on more here in just a little bit. And then these are some of the position titles that students get, once they graduate with a public health degree. Now, regardless of concentration, whether you do community health, pre-health, or worksite, you do still graduate with a Bachelor's of Science in Public Health. So if you want to do anything outside of practicing medicine, these are some of the more prevalent titles that our students go on to become once they graduate. These are some of the classes that our public health students take. There is a core set of classes that is required for all 3 concentrations of public health, and those are like the health problems, health disparities, your principles of public health class, environmental health, statistics, and then other than those, there is an epidemiology is also a core class. And other than those, there are ones that are very specific to your concentration. Community health is going to have ones like global health, women's health, a community health theory class. Worksite has a more health classes, health in the workplace, and a couple other environmental health classes and some business classes. And then pre-health also has those patient education classes, and it's more science heavy again, of course, because you have to get in those medical program prereqs. So this is the 4-year plan for our pre-health concentration. And everywhere that you see the restricted elective that is circled in red on this slide is where you would get to choose from the pool of classes that is specific to the medical program that you want to pursue. And then internships. So community health and worksite do require an internship. It is a formal 12 credit hour internship class that you take your very last semester. You have to be done with all other degree requirements. You don't take any other classes along with your internship. And we do have an internship coordinator that will help guide you on that process as the time gets closer. What you see here is a list of places that students have done their internship in the past. This also helps students narrow down like which avenue of public health they want to pursue. And while an internship is required for community health and worksite health, our pre-health students do have the option of doing an internship, a 6 credit hour internship, and they can do those in a more clinical setting. But again, here's just some examples of places that students have done them in the past. And you can do them anywhere. They don't have to be in Greenville or in North Carolina or even really in the United States. And then research. There are a ton of research opportunities within our department. And I will let our student ambassadors talk a little bit more about that here shortly. But students can start with research as a freshman. You do not have to be, an upper level or upper class student to get involved with research. And there are a ton of research opportunities, I think, in the department as a whole, also in environmental health. And then that being said, Riley, have you done any research?
Yes. So last year I served under Miss Williams and Miss Wallen as their research assistant with the School Health Training Center. And then for the Honors College, my signature project is also in the public health department. I'm doing an environmental audit of STI testing.
All right. And then Rachel, is there anything else I should add?
I think you did pretty good. We do have something we always like to highlight, as well as, so on top of internships with student involvement, we do have a lot of clubs, just kind of with ECU in general. Kind of student clubs involvement is very big, but just within HHP for like major specific, for both public health, environmental health, and then kind of any pathways you want to go if you're looking at, dental, medical, PA, this kind of, preparing for those. We have a lot of clubs for them. So I, always recommend kind of coming in, the first year or two, get involved on campus. It's a great way to just learn more about, kind of what other students that have similar interests are doing. It's a good way to learn about different types of research or different types of jobs that you may have never even heard of before. So we do a lot of that kind of within just the department and our college in general. And then study abroad as well. We do have, again, ECU in general, doesn't have to be with, the HEP department, but we do offer specifically with public health, at least one, if not usually two, public health programs in the summer, which are like 2.5, 3 week programs. So it's not a full semester, and it's faculty led and you're with other ECU students. So it's a really great way to travel, and you get 6 credit hours that go towards your degree typically for that. And it's also, we always like to highlight just on the kind of admission side with study abroad is in the summer, if you are out of state, the tuition that you pay for the credits for the study abroad in the summer, you pay in-state tuition. So it's a really great way to, again, just pick up, kind of some credits over the summer, but also just to travel and kind of get more experience. With public health, a lot of times it's looking at like public health policy differences in different countries, but they'll each kind of have their own theme. So like, yeah, this past summer they did one to Ghana and one to Switzerland, France, and Italy. So, there's different ones every summer that kind of change, but again, just kind of student involvement in general, I say this college does a fantastic job with, and there's a lot of different ways to get involved.
Yeah, I think that's about it for our public health presentation. Do we want to go on to environmental health and then come back to student experience?
Yeah. Does anybody have any questions about public health before we move on to environmental? Wonderful. We will now move on and then we will chat with our student ambassadors.
Oh, William, did you want to talk about environmental health? Oh, I think you're muted.
Okay, I'm sorry. Just one thing to add about the internship. We have a 3-hour and a 6-hour internship, but just in a nutshell about environmental health, all those factors that affect public health and the environment, whether we're talking about water or wastewater, talking about soil or mosquitoes, or talking about anything that can affect your health or the environment. I just want to add, it's that type of profession or that type of major that affects every aspect of your life. When I generally try to sell the program to students, I talk about a typical day or a typical time on a pirate ship, and how do they deal with water, and how do they deal with wastewater, and how do they deal with food, or how do they deal with solid waste. So it's just one of that very exciting and passionate profession that if a student want to work outside or work indoor or do part of their work, in the lab, or part of their work out in the field, environmental health has something for you.
And I can kind of add on a little bit too with kind of looking at like different, so just with college in general, it's always a little confusing with like departments and majors and all that. So with the like public health and environmental health, so there are going to be like two separate like majors, but we're in the same department. So they have a lot of overlap and kind of same end goal, I guess, with kind of, preventing disease spread, just overall healthier population. So environmental health is going to be a little more on the science heavy kind of side as well. And this year they kind of started with, we now require general chemistry 1 and 2 and physics 1, microbiology, organic chemistry 1, anatomy and physiology. So you kind of get a little bit of all the different sciences, and then we're going to build on those kind of into the kind of core environmental health sciences. It's a lot of the environmental health or environmental science part you think of with those kind of core sciences, but it's looking at how we're going to connect those to public health and how it affects people and populations with like wastewater treatment, air quality, and all that fun stuff. And William, if you wanted to talk a little about, I know I don't think we have environmental health student in here, but a little about like the labs that we have for environmental health and maybe where some of the internships kind of are that students do.
Oh yeah, I'll be happy to. Yeah, we have a water and wastewater lab. Our students get hands-on experience. A student looking to do some research can work in the mosquito lab where they're looking at the spread of diseases through mosquitoes or other vectors like ticks and fleas. We have an occupational health and industrial hygiene lab. Matter of fact, environmental health is broken down into 2 different concentrations. We have an occupational health and industrial hygiene concentration. Then we have a public health protection concentration. We have a lab where we look at everything from noise to toxic substances to water pollution from different types of sources, whether it's from stormwater or earthquake or rainwater or flooding, anything that can affect people's water, whether we're talking about drinking water or recreational waters, right? I'm teaching the class now talking about public swimming pools and spas and ocean dumping and those type of things as well. Once again, the thing about environmental health, it touches every aspect of a student's life or our lives. So it's kind of easy to sell once we can get in front of them and tell them about this, the great opportunities in environmental health. Our internships, students get great internships. We're an accredited program. So our internships can be, local environmental health. It can be on a state level. It can be federal level. We have students who work on a Indian reservation, and to hear students come back talking about how it changed their lives, just teaching something as simple as hand washing or something as simple as diaper changing, preventing diseases through proper personal hygiene. It really makes a difference when we can sell it to students. They can really feel a change in the whole demeanor by experiencing some of these internships. But again, the cool thing about environmental health, your internship can be in water, it can be in food, it can be in occupational health, it can be with mosquitoes, it can be any of those things and even more. Haven't you talked about maybe radiation protection and body piercing and tattoo, infectious diseases in the hospitals? So our students get a wide variety of different internships to choose from. And a great thing about our program, we have a great relationship with local environmental health, county environmental health. We kind of know folks in each one of these counties. Matter of fact, a lot of our students have left and worked in some of these counties. So if we're looking for an internship, we generally can reach out to our students that are already working. They will make us aware that there are internships for our graduates that are coming up. So again, the internship is great. The mentorship is without a doubt a real benefit. And one of the things I can talk about in environmental health, there is a need for environmental health specialists. So we try to promote not just the environmental health BS, but the minor in environmental health as well. As Rachel mentioned, it's really science heavy when you talk about the BS degree. So I always tell students, if you're having a problem with science, they might want to consider the minor in environmental health, where you can bypass some of those courses, but at the same time, you can do the same internship and compete for the same jobs that our bachelor's degree students apply for as well.
Yep, and I'll mention too with the minor, it's a good point with these programs of public health and environmental health, both of these have minors, which is basically just a smaller group of classes that you can take that can be tacked on to any other major. And both of those are open to kind of any other majors. And you can kind of mix them in. So like I said, they have some classes that overlap. With public health, if you were interested in having like a public health major, environmental health minor, we have quite a few students doing that.
Yeah.
And the work site health concentration works a little better. There's like one more class you have for that. But for any of the concentrations, you'll have 2 classes completed for the minor already. So it typically only adds I want to say about 18 hours, about 6 classes kind of on of those environmental health classes. So if it's something you're interested in, kind of in between them, they go well, very easily, go together well. So you can always talk to, that's where advising comes in. So with me and Kelsey, we advise kind of fully for both majors. And if you have questions with the minors, we can kind of always help with that. So if you have an interest in it, bring that up, or if you end up in another major somewhere but still have interest in it, bring it up to, like I said, your academic advisor, and they can help you kind of work that into your degree plan. All right, any questions with environmental health? Okay.
And then I was going to say, if Riley and Sydney maybe want to go briefly over their experience as students in the public health major, kind of what you plan to do with your degree, and your favorite part about it, that would probably be helpful. Riley, you want to start us off?
Yes, I will start. Okay, so I'm a pre-health professions concentration. So that pretty much means I want to go on beyond just doing like something public health related. So I want to be a PA. That's my dream. And then, I mean, I love public health because it allows me to, broaden my horizons when it comes to medicine, but also like I'm on a first name basis with some of my professors. And that's just normal around here because it's so small. Like I have a class of 15 students and we do group work all the time. And that's just, we all know each other. We float class to class with each other. It's tiny and everybody knows everybody and it gets you where you need to go.
Yeah, I'm also on the pre-health track, and I was originally interested in medicine. Now I'm leaning more towards pharmacy, but honestly, with having taken all the classes I have so far, I'm also super interested in community health too. So I definitely feel like it is a great major for those looking to be on the pre-health track or looking to go to some sort of medical professional school after because you learn so much just about, how to take care of patients and understanding different factors that go into people's health. And I feel like it just makes you such a well-rounded person when it comes to understanding those that you'll come in contact with and be taken care of. So I've definitely been amazed by all that there is to it. And like Riley was saying, definitely a close-knit department. I have loved all my professors there between across the board for all of them. They've worked in so many different sectors of public health, and honestly, that's what's helped me learn what I want to do is hearing about all these professions that I didn't even realize were out there. I feel like the public health department and the professors I have done a great job with that, not just getting involved on campus, but also off campus as well. They do weekly emails with just stuff going on, so that's really helped me get involved. I know one of the things that I did earlier this year was just a conference. It was actually in Raleigh, but it was um, just a public health conference focused on rural health, and I was able to learn so much about that and just the fact that I got that opportunity through um, the public health department was awesome because I had no idea that was happening, but I was able to go and learn about stuff going on in the state that, public health measures that I didn't even know about. So that was awesome that I got to do that. So, yeah.
And it's not just the public health faculty, like everybody has to take Mr. Hill's class and he's awesome. So I just got to put that out there.
Mr. Hill is the best.
He's definitely a fan favorite. Yes.
I will
Thank
say
you.
too, oh, sorry, go ahead.
I'm just saying thank you.
For the goat. So I will say I came from the medical school before I was at HHP, and we did have quite a number of students that came through the public health program, which was wonderful because, like Riley said, you get that patient care on top of your science and everything else that you need prereqs. But medicine isn't the only route. Like Sydney said, she started with medicine and went pharmacy. There's dental, there's PA, there's a plethora of things you can do. Environmental health, you can do stuff with OSHA, you can work for a city, state, local government. There is a one there, I'm sure there are a million careers that I am forgetting because there are so many options with these tracks that you really have a wide variety of careers that you could pick from. And once you decide which ones you want to do, these lovely people here can help you find internships, placements, anyone to work with in the community, volunteer, all the wonderful things. So I will, and any other ads from our wonderful student ambassadors? Awesome. Any questions from our participants? Welcome, everybody. I know it's a little much, but now you have our contact info. So if you have questions for us, you can let us know. I also just like to plug that I think Rachel had mentioned something about scholarships. So HHP, or maybe it was student groups, but I was thinking scholarships when you said it. HHP does have a ton of scholarships for our students. We love to give away money that is not ours and fund your education. And our donors are wonderful. They are either alumni or friends of the college. They are very, very active in everything our students do and really enjoy seeing everything they're doing from projects to classes to volunteer to conferences. We love conferences and all of the experiential learning that goes along with that. So I'd like to plug scholarships. And then upcoming, if you haven't signed up already, on October 25th is ECU's open house. So that will be on that Saturday. I believe it's in the morning. I need to look at the start time. But if you can join us at ECU Open House, we will be there with all of our programs, and you can chat with some of us and some of the faculty and staff that make this wonderful thing possible. Kelsey and Rachel, anything I forgot or y'all need to add?
We always like to kind of plug, with academic advising sides, we can help, guide the best we can with kind of choosing majors and minors. But if you are, coming into ECU, we see it a lot more frequently now, of coming in with credit hours, whether you're doing like dual enrollment, AP classes, things like that. Our information's on our website as well, on our HHP website, for all the different advisors, and it shows what majors we advise for. And it has our general HHP advising email as well. If you do have any questions kind of coming in about, how certain classes are gonna, transfer over, or if you're, maybe a junior looking at taking dual enrollment classes senior year and have questions about which ones are better to take, you can always reach out to our office for kind of that side of it as well.
Yes, that was me coming in, and Kelsey was my advisor, and she was awesome, and she helped me so much. And so definitely reach out.
Well, thank you, Riley. I wish I still had you.
We are very responsive in HHP. So if you do have any questions about programs, ECU in general, scholarship, financial aid, we can either help you or point you in the right direction to the person that you need. So these are all friendly faces that are willing and ready to help. So yeah, again, I'm going to ask, do we have any questions from our participants? I hope that you guys learned a lot tonight, and this will be recorded, so it will be posted for future viewing if you need. But thank you all for attending our virtual HEP academic night. I'll let everybody go a little early. Sorry again for the tech issues, but thanks for working with me. And yeah, everybody have a great night. Where can I find the recording? We will work with admissions to get that out to y'all.
And
So
I
once
do just want to say, just on the behalf, I'm so sorry.
Nope, go ahead. I was going to say we have our friend from admissions. Perfect timing.
Yes, no problems. Yeah, I just wanted to add just from our department as well. Just thank you all students for taking the opportunity to learn not just about the university, but also your academic program of interest. And I think that you guys are doing a great job of taking advantage of these opportunities to learn more about how the university and your department can really support you throughout your journey. So I really hope that you guys took this opportunity as a very great resource. The last thing that I just really wanted to provide in the chat. So as you're going through the just general admissions process and you may be wondering, okay, where do I get started or who may I reach out to as I along the way as I have questions about like my admissions application, I do want to just provide this general link here, and this will take you to our counselor list where you're able to review and look at who your admissions counselor may be for the university. So if you just go through, if you're living in the state of North Carolina, you will just click that you're an incoming freshman student, North Carolina resident, and then selecting your county that you live in. And that will show you exactly who your direct point of contact would be in our office. For an example, I work with all of our students that come from the Triad region of North Carolina. So if you come from Greensboro, High Point, Winston-Salem, or anywhere around that area, I will be your direct point of contact.
Thank you. So we have our admissions connect our admissions link in the chat as well. And then I went ahead and put since you said link, I was like, good idea. I went ahead and put our HHP advising link in there so you can learn a little bit more, and there's some contact info as well. So with that, I will wrap it on up. Thank you all again, and we hope to see you on October 25th for ECU Open House. Oh, sorry. Oh, yes. Thank you. Go Pirates. Beat Coastal.